This is a demonstration of tracheostomy care with an inner cannula. My patient at the head of the bed is raised to at least a 30-degree angle. I have done my standard steps. I will think about pre-oxygenation because I will be removing the oxygen. If I have an order for pre-oxygenation from the physician, I can increase the liter flow for whatever amount of time the physician states in his order, or I can have my patient take deep breaths. In this case, Ms. Nightingale has a relatively low liter flow, and I'm not concerned about her lack of oxygen as I'm doing this. So I'm going to remove this oxygen at this point in time. I have two solutions that I will be using. One is normal saline, and I will check the expiration date, palm the label, and lip. And I will also be using hydrogen peroxide, and I will check my hydrogen peroxide. Generally does not have an expiration date on it. I will palm the label and lip. And you may have a facility policy about once a bottle is opened. I have a trach care kit, and I have my scissors out and ready to cut ties when I'm done. When I open this, I'm going to open it so that I'm not moving over the sterile field of my tray. My gloves are on top, so I will, in this case, I feel like saying a word right now that I will not say because it wouldn't be appropriate. Okay, I'm going to touch the inside of this glove and lay it on the sterile part of the flap of that tray. Lift up and back. I'm going to consider that this is contaminated at this point in time. I'll pick up my drape where I will set up my sterile field. And when I lay this on my sterile field, I'm going to lay it coming towards me so that I'm not reaching over it. I can now set up my field. I recommend that you keep your things right in the center of your field. I've got Q-tips and pipe cleaner and brush that I'm going to use for cleaning. I have a new trach tie. I can set that to the edge of my field. That does not need to remain sterile. And I have a gauze for around the trach when I'm completed, and that again does not need to remain sterile. I have 4x4s that I will be using to dry with, and I'm just going to open those up so they're easy to pick up. Now I'm going to pour my solutions. I had 3 containers. I'm going to put saline in all of them. And if I have saline left, which I don't, but I believe have, and I'm going to pour hydrogen peroxide just in the containers that I will be using to clean. With my non-dominant hand, I will remove the gauze that's around the tray, check it for any drainage, assess it, and now I'm ready to clean around the tray. I will always come to this sterile field with my sterile hand. I'm going to demonstrate first picking it up with a cotton bud, transferring it to this hand, using my hydrogen peroxide to clean around the base plate cannula. Drop from up high, and I will come again with this. So now I am going to rinse around my cannula. So I've dipped this in the normal saline. We had a little technical problem there, so I hope this is not repetition. And so now with this hand, because this needs to remain sterile, I can use this hand to move my face plate to get under it if I choose. Neither is right or wrong. It's going to depend upon the situation that you're in. And now I want to dry around the the trach. And so sterile hand here. At this point in time, I like to transfer it to this hand, being sure that I don't contaminate this in order to dry. Now I'm going to remove the inner cannula, and this inner cannula I will drop into my peroxide solution. I need to come to the field again with my sterile hand, because my field is still sterile. I pick it up by the brush end and transfer it to this hand so I don't have any contact between my sterile and non-dominant hand. And I'm going to use the brush to clean this inside and out. Now and if you notice, I picked this, the inner cannula up with my sterile hand. Once I drop it with my non-dominant hand, from then on I will be using my sterile hand, which is now the most clean of both my hands. Now I'm going to drop this into the saline for rinsing. I'm going to come to my field again with my most clean hand, transfer this to this hand, handle my inner cannula with my most clean hand, and I can rinse with this, drop it, and if I need to lay this down because I want to dry the inside, I can lay it right down on my sterile field. Pick this up. I can dry inside. I can now with this hand dry this with my 4x4s that are left. And with this same most clean hand, I will reinsert my inner cannula and be sure that it is snapped. Now I am ready to replace my drain 4x4. We want this to be as flat as we can make it so there's no irritation or minimal irritation from that. And I'll put my tie on at this point in time. And there's many different types of ties or ways to hold these trach in place. We never want to leave it without a some type of tie or holder, because these trachs can be easily coughed out, very easily. And another thing I might mention while I'm doing this is when you are working with a trach, we want to encourage people to cough to get these secretions up themselves. But it's going to be the same hygiene we use with somebody who's coughing without a trach, and that's that we want to have tissues there, and we want to encourage covering of the trach when that coughing is occurring. And when the person does cough and has mucus expelled, it comes at a greater force than it would from our mouths, because it has a shorter distance to come up from the lung area. Once you have tied this, it's either going to be a square knot or a granny tie, and you want to check to be sure it does not slip, and you want about no more than 2 fingers distance to get under just to kind of check to be sure it's in place. At this point in time, I will cut off my older trach tie. In this case, I want to be sure that I don't cut this one. So I'll cut these off. Be sure my patient is comfortable. Get oxygen back in place at the liter flow that it was prior to this cleaning of the trach. And perform my standard steps with my client. And thank you.